Assalamu alaikum. Hello and welcome to Care Across Cultures. Another episode of the show that looks at healthcare and the people who spend their lives caring for others. I'm your host, Mirban Hussain. I hope everybody's had a good weekend. I've had a wonderful weekend. Yes, weddings and a funeral. I think a lot of my listeners out there who share the same sort of heritage as I do will understand that, it is wedding season, it's fully upon us, and there's lots and lots of weddings. It's always a pleasure to be invited, it's always a pleasure to go and share this happy moment with families and friends. Today's topic, voices that matter. What does that actually mean? So, I've got a question. When did you last fill out a patient satisfaction survey? If you're like most people, probably never. And that's the problem. Healthcare runs on feedback. That's how we improve, that's how we make things better. That's how we make sure that we're not doing something which has a negative impact. But we're only hearing from about 20% of patients and family members across the board. And these are usually the ones who are already comfortable speaking up. And the rest of us stay quiet. Perhaps they're too sick if they're patients. Perhaps they're too scared. And frankly, some of you might just be a little bit too fed up with another form. And these are all understandable issues. With my guest today, we'll be talking about how to get real feedback from families, especially families going through the worst time of their lives. I want you to think about that for a moment. If you can get honest answers from someone whose loved one is dying or has just died, you can probably crack this problem anywhere. We're at our most vulnerable then. So let's find out what my guest, who I will introduce in a moment, and her team have found out about the families who don't usually speak up and why it's important that we get them to speak up and they speak up. And what did they have to say? We'll also be talking about new methods, new ways of getting feedback, so that we can actually listen to patients and their families. So you are listening to Link FM 96.7, Care Across Cultures, with me, your host, Mirban Hussain. We'd love you to join the conversation on our studio hotline, which is 0114 261 8181, or you can send us a WhatsApp message on 079 398 49339. As always, the views and opinions expressed on this programme belong to me and my guests, and are not necessarily those of Link FM, the PMC, Rotherham Hospice, or of the organisations that we represent. So, let me introduce you to my guest. Hello, Tracey.
Good morning, Megan.
How are you today?
I'm very well, thank you.
Thank you so much for coming and joining us. I know that you've got a really busy job, and it's a busy time for you at the moment as well, isn't it?
Yes, it is.
It is. So, Tracey, just tell me a little bit about yourself. What you do, where you work, and a little bit about what this job title actually means. I don't really understand it, and I'm sure lots of my listeners may not have come across a job role like yours before.
Okay.
All yours.
All right, thank you. So, I'm Tracey. I live in Rotherham. I work at Rotherham Hospice now, but I've been a nurse for around about 44 years. My job at Rotherham Hospice is the Director of Quality and Assurance. And you're right, lots of people don't understand what that actually means. And it's quite difficult to break it down, but it's about trying to understand how we can get the experience right for the patients that we have who need to use our services, their families, their loved ones, their wider networks of people. And we get lots and lots of really lovely feedback and people telling us how lovely their stay has been with us. But what I want to know about is what can we do to make it more personalised for the patient, for the families, and how can we improve on the experience that they have with us, because that's really, really important. And yes, lots of forms go out for lots of different things in healthcare, but my job is to try and make that meaningful. So I want to listen to, you've told me this is what we're going to do about it.
Yes.
Taking into account what people want and to meet the needs of as many people in as many different ways as we possibly can.
Fantastic, thank you. Now, I did mention earlier that 20%, we only get about 20% feedback. These are figures which I googled, as we always do. How sort of representative is that in Rotherham Hospice? What sort of percentage of feedback do you actually get?
So we don't measure our feedback currently on the percentage of feedback that we get. So we have a very open way of providing the opportunity to people, for people to provide us with feedback. And we are very reliant on people coming forward and wanting to do that and to help us to understand. And part of what I'm wanting to do is try to do it in a slightly different way moving forward.
Right, okay.
So that we can start to benchmark what that is. But we need to do it at the time that's right.
Yes.
For the person that's doing the feedback for us.
And that's got to be difficult, hasn't it? When is the time right?
Yeah.
Because not just for the fact that it's end-of-life care. Someone may be dying or they may have passed away.
Yes.
And, you know, what have you found through your experience in terms of what is or may be the best time, or what's the worst time actually?
Yeah. So what I've learned is that it's different for everybody, and actually there is no set time that's the right time to do it, and it's trying to be there for people when they recognise themselves that it's the right time. And sometimes a lot of our families will use our counselling services, and through the counselling they identify that they do feel it's the right time to talk about it. Some people want to talk about it at the beginning of a journey towards the end of life.
Yeah.
Some people want to be very organised and actually have everything organised that they want to do very, very early in their sort of palliative pathway. So we try to be as flexible as we can and to offer a variety of different ways for people to come and do that with us. And we try to reach out to them as well. And it's balancing that, building that relationship up helps you to balance when the time is right to do that. Yeah. For some people it might be 2 or 3 years down the line.
Okay, so a very wide ranging there. couple of things that you've said that I would just like to pick up on. One is that you mentioned palliative pathway, and palliative is a term that whoever mentions it on this programme, I always ask them to give me their definition, because it's not an easy one, is it? So what's your definition of palliative?
So somebody who's palliative has got a life-limiting condition or a life-limiting illness. Now, there's two ways you can look at that. That could be something that's been medically diagnosed and is expected to happen, within a short, medium or long time scale. Or you can look at it differently, in that actually we're all on a journey through living our lives and moving to, what will be the end of our lives. So palliative care is about how we can help people to live their lives to the best of the things that they want to do. And it is about, some people will have symptoms, and we can help them by managing those through medical, nursing, therapy treatments, or by providing support, counselling, somebody that they can talk to, and helping them to understand what's happening to them.
Okay, which sounds really great. Thank you. You also mentioned about feedback that you've received, and you started off by saying that it's really lovely feedback that we get at Rotherham Hospice.
Yeah.
Have you had feedback that was not lovely?
Yes. Yes.
And because it's I've always found that good feedback, lovely feedback is great, so we can carry on doing the things that we're doing. But change actually really comes from negative feedback, doesn't it? Now, in terms of percentage, I'm putting you on the spot now. In terms of a percentage, with all the feedback that you've got, would you be able to put a percentage on the amount of negative feedback as in terms of good feedback?
Yeah, I would say that negative feedback would be about 3%.
Wow.
So it's very, very low.
That's very low.
Yeah.
Very low.
Yeah.
Because one of the things that you've said which really resonated with me was that it's very difficult to get feedback, and the way that we try and get feedback, and because no one time, no one sort of format of feedback is the best for everybody. So that must be a huge drain on resources, because Rotherham Hospice, like all hospices, it is a charity. And how do you manage those resources in terms of how it must be very difficult?
It can be challenging, but I think it's trying to have a variety of different ways to obtain that feedback. And I have a small team, and we are responsible for looking at all of the feedback. What does it tell us? What can we do with it? But we work on a basis that feedback is important for everybody to get it. So our clinicians have very good established relationships with their patients and with their families, and through conversations, whilst they're with us actually on site at the hospice, and also in their own home, and patients in their own homes, or where we come out to do community visits, where we're invited to come and talk to people, then we encourage all of our staff to try and obtain feedback, and ask people. Communication's a really powerful tool for us, and it doesn't have to be a form that somebody fills in, but it can be about actually the conversation that you have with us. And people sometimes, as I said before, when they come for bereavement counselling or support at any point in that journey, will often talk to us about their experience. And sometimes that's about the experience in the hospice, or sometimes it can be about their experience of all of the health services that come together to look after somebody
Right. So
together.
it sounds very dynamic then. It's not, as I thought, and perhaps some of my listeners may have thought, it's not always about a form that you're given
Yeah.
or a link that you sent via text or an email.
Yeah.
Please fill this in. But you're talking about something very dynamic, and where the whole of the hospice team is involved in that feedback,
Yes. Yeah.
which is a really wonderful way of getting that feedback, because as you said, that you build trust, staff are building trust with patients, and when you trust someone, you're much more likely to share what you really feel, aren't you?
Yes.
Whether that's good or whether that's, negative.
Absolutely, and it's trying. I think the trust is a very, very important part of it, because when somebody is at the most vulnerable stage
Yes.
of their life, they can sometimes feel, if I say something or make a fuss, what's going to happen. So to be able to build that trust, that people feel that they can say to you, look, all of this was marvellous, but this is what I experienced, and for me this would have been better if.
Yeah. And then obviously we'll talk about that later, what you do with that feedback and how that sort of impacts on service change. But one of the things I do want to ask you is that we've talked about feedback and we've talked about people sharing this feedback with you. Now we know that Rotherham has a diverse community where language may be an issue, where people may not speak English as a first language, and also, with lots of other vulnerabilities as well. So how does Rotherham Hospice currently make sure that we can access that feedback in maybe different languages or for different, conditions?
Yes, absolutely. So we can have any documents that we would have, or leaflets and those sorts of things, translated into whatever language we may want them to. We also have access to something like a language line, where we can have an interpreter who can work with us, and it's really important when you're first building a relationship up with somebody to find out if that's communication that's going to be needed, so that you can plan for it and have it available within there. You yourself have done some sessions within the hospice where you've introduced some phrases.
Or the essential phrases, which has been really good, yes.
I think is really, really important for us to be able to do that. It helps with the building of the relationship, and to understand some important things,
Of course.
In our patient rooms we have boards where we write what's important to that patient, so it can capture that type of language. But obviously it's not always just about the spoken language. Sometimes it's about helping people to write.
Yes.
Sometimes it can be about people who are deaf, people that have visual problems,
Of course, yeah.
Or may have disabilities. So it's taking all of that into account.
And this is why I think that, it's amazing that, we can get feedback from those people, as I said right at the start, that some people who are naturally quite sort of talkative, open, and they've got, they're sort of quite confident, and they can do that. But some people, even if they don't have any sort of language issues or other health issues, they may not be sort of, confident in sort of sharing.
Yes.
So that it's really important. No, thank you so much for that. Now, I want to talk a little bit more about, before we go into a break, because I've got lots of other questions I want to talk after the break. So you said that you've been a nurse for 40 plus years? Long time.
Long time.
A long time. What was the reason you got into nursing? And because 44 years is a long time to stay in nursing or in any field. I just want our listeners to understand you know, your sort of reasons for nursing and, you know, staying in it for 40 plus years is a long time. If you can share that with us, please.
Yeah. So I went into nursing first and foremost because I wanted to make a difference to people. I wanted to be able to do something that helped people. But I also enjoy the science behind health and the whole life story. And then within nursing, you look after the whole person and the whole family. And that's really been important to me throughout my career. So I've always worked on putting the patient and the family and the staff that I work with at the centre of what I do. So I think that's the most important thing.
Has this always been the case, though? Because I, you know, go out and do a lot of community outreach and speak to lots and lots of people from diverse communities and diverse health conditions. And some of the responses that I've had and some of the comments people have made have been about, oh, well, they, as in nurses or you know, medical professionals, they don't seem to care about me. They're just sort of doing something to me. But what you've said is in a stark contrast to that, because you've talked about, yes, making a difference to people's lives, but you've talked about not just the patient but the families and everything. Is that something that you've obviously personally had, but is that something, have you seen wider afield in nursing and in the medical field? Is that?
Yes, I think that I have the benefit that I trained in back in 1983, and the training was very different to the training that's received now.
Okay.
But it provided me with a very, very strong basis, which has come with me through the whole of my career.
Right. Okay.
And I've worked with people that have the same ethos as I do, and I've worked with people that have trained in a different way. But I've had the benefit of both elements of it, and so I think it makes it more rounded. Yeah. And through my role as a you know, as I progressed as a nurse, I've taken that with me and tried to instill that with the nurses that I work with, the nurses that I train, the healthcare professionals that I train, the doctors that I work with, about how important that is.
That's wonderful. Thank you so much for sharing that personal journey, and I think it does make a huge difference. Now, we are coming up to a break. If you've just turned in, you are listening to Care Across Cultures on Link FM 96.7 with me, your host, Mirdwan Hussain. I've been talking to Tracey from Rotherham Hospice, and we will carry on this conversation after this short break. Assalamu alaikum, welcome back to Care Across Cultures with me, your host, Mirdwan Hussain. You are listening to us on Link FM 96.7. If you'd like to join the conversation, please call us on 0114 261 8181 or send us a text message on 079 398 49339. We would love to hear from you. We've been talking about a very, very important part of healthcare and voices that matter. And this is about feedback that patients and families give for any service that they have received, whether it's a hospital or whether it's a hospice or anywhere in healthcare. And yes, we all like to hear about the good things, that, you know, you had a wonderful experience and all your needs were met. These are always really good to hear. And one of the benefits of that is that so that we know what we're doing right and what works, and we can carry on doing more of that. But what's really also equally as important, if not more important, is when you have a not such a good experience, where things haven't worked out right, and we really want to hear about those as well. Because if we're doing something that's having a negative impact on our patients, our families, and I'm not just talking about hospices now, I'm talking about healthcare across the board. Yeah, GPs, hospitals, dentists, wherever you go for any time of medical or nursing care, whatever. We really need to know that. Now, one of the big problems that we have, as I mentioned right at the beginning of the programme, is that roughly about only 20% of people give feedback. So there are so many other people out there who don't give feedback. And it's really important that you do. Because these services are your services. तो अभी हम बात कर रहे थे कि फीडबैक, पेशेंट सेटिस्फैक्शन, इसके बारे में. तो ये एम इसलिए है क्योंकि अगर हम कोई भी सर्विस है, हॉस्पिटल, हॉस्पिस, जीपी सर्जरी, अगर आपको अच्छी सर्विस मिल रही है तो ज़रूर बताना चाहिए कि ये हमारे लिए अच्छे था, ये डॉक्टर अच्छा था, ये नर्स अच्छी थी, ये रिसेप्शनिस्ट अच्छी थी, इन लोगों ने ये किया मेरे लिए, वो किया. लेकिन अगर आपका इंटरेक्शन जो है अच्छा नहीं हुआ तो ये भी आपको बताना चाहिए. क्योंकि अगर आप बताएंगे नहीं कि मेरे साथ अच्छा सलूक नहीं हुआ, मुझे सर्विस अच्छी नहीं मिली, मुझे ये नहीं मिला, वो नहीं मिला, तो चेंज नहीं आ सकती. So we're going to go back to Tracey. That I was just a little bit of a translation just to help some of my listeners understand what it is that we're talking about. Okay. So, Tracey, we've talked about the feedback challenge. It's a challenge. Yeah? It's not like asking about a restaurant meal, is it? No. No, it's not. How do you currently gather... I mean, you've talked about it, you know, in general, but what I want to know is how do you gather meaningful feedback as a process at the moment? Yeah.
So currently we have forms which have got a small number of questions that are asked about patients' and families' experience with us at the hospice. And they also then have a free text box so that people can write anything additional that they want to put into there. And we have them available within the hospice. Our staff have them and they will give them to families where they think that, you know, it's okay to do so, that it's the right time, timing for that. We have them around the hospice. We have them in our dining room and the kitchen for people that use the services within there, and our patient and family support services team also share them with people so that there's a variety. There is an electronic version that's available on the hospice's website, but there are people who, you know, are not IT, not into technology, and so we need to try and make that available in a variety of different ways for people. So that's the main way at the moment.
Okay, that's fine.
Send that out.
But I suppose people could, if they could just phone up, couldn't they?
Yes.
Reception and say, I want to give you some feedback, and reception, whoever picks the phone up can, you know, take that feedback. So that's, so there are plenty of opportunities and plenty of ways. It's not that you're not saying that, okay, fill this form in. If you don't fill this form in, that's it. You are very open.
We're very open to it. We have a dedicated email address for feedback, so people could just send us an email if they wanted to. They can pick the telephone up if they want to. And I would very much like, as we are out more into the community, to build the relationships up so people could just come up to us and say, can I talk to you?
And we can capture that.
Yeah.
Okay. So the next question I have is, can you share a specific example of where family feedback or patient feedback directly changed how you deliver care or something like that?
Yes.
You may not have, but you have. Fantastic, thank you.
Yeah, absolutely. So, a lot of the where we have come across where something hasn't gone quite as somebody would expect to, often comes down to communication, how people talk to each other. And one of the things that I became involved in was with a lady who had accessed counselling when her husband had died, and she was struggling to move on with the counselling because of something that had happened, and she tried a number of times to express that. So a counsellor spoke to me and asked me if I would speak to the lady, which of course I went to speak to them, and it turned out that the lady wanted to tell us where something hadn't been how she would have wanted it to be, her experience, and it was affecting her. And she'd been told a number of times that she had to write and say what it was. Well, the lady had got problems with her wrists, so she couldn't write, and actually she didn't have good eyesight, and she couldn't do that, and she didn't have any family support. So I chatted with her, and I arranged to go to her house and sat down, had a cup of tea, and tried to build a rapport with her. And she talked to me, and I asked her if I could write down what she was telling me so that I could capture everything for her, and then she could check it to make sure I captured it correctly, which we did. And what became clear from the conversation with her was that actually it was the communication, and it was the communication between not just the hospice but the other people that were involved in the care of her husband.
So is that other professionals? Or?
So that was other professionals, other services, and it wasn't as good as it should have been.
Right.
And obviously that had an impact on her and her husband. So what we learnt from that was how important it was as a multidisciplinary team, not just in the hospice, but actually with our colleagues that work out in general practice, that work out in community, to actually be joined up and to be talking together. So what we actually did was get together and talk about what we'd learned from this lady's experience, and we made changes about how we worked together to make sure that we were communicating with each other effectively, but then also with the family effectively as well.
Well, that sounds wonderful, but I've got a question now. Will it not cause problems and issues if within a multidisciplinary team where lots of people are supporting an individual, one service, one professional is amazing and all the others aren't? I'm just thinking of, that's going to cause some...
So what we learned very much from that was that there were lots of individual services doing good things for this family, but there was nobody that was holding the ring for the coordination. So that's where we agreed that we would have one person who would hold the ring for that coordination, so that if there was something that wasn't right in another service, the coordinator could actually oversee that and pick it up with that service and make them aware, and so that we reduce the risk of that happening.
Well, yeah, because I mean that sounds really, really good, because you've got it's supporting the patient and the family in such a way that they are not having to repeat their story with someone that they may not have a rapport with anyway. Yeah, they may not have built that trust, and if that one person that they do can share that and help to change. Well, that's a lovely story. Thank you so much for sharing that one. So let's go to some other questions. Right. Okay. Have you got... I know we've talked about this, or you mentioned earlier that that we need to make sure that more people can provide feedback. And from what you've said, there are so many ways and methods that people can provide feedback already. And one of the, I think, issues challenges may be that people may not know about all of those. Okay. So that's one challenge that I'm looking at. The other one may be that all of the methods that we already have are still not sort of appropriate or responsive. So I'm going to ask you some really difficult questions, which I said I weren't, but I'm going to ask you these anyway, because I'm sure you'll be able to shed some light on them. One is, what is it that you're doing at the moment? Because you're doing a full review of how we access feedback and how to increase that feedback. So what are your thought process? What have you put in place? What are you planning to put in place? And then I have a follow-up question which I will ask after.
Okay. So what we're doing at the moment is we are very much focusing on what is important for the people that use our services. So we do have to, there are certain things we have to do as part of our registration with the Care Quality Commission. So this is something actually about what's important to the Rotherham community that use our services. And we are linking it to some of the national work that's being done about what people nationally have said is important about accessing hospice services. So we are looking at 4 or 5 different areas around compassionate care, were staff available and ready when you needed them. You know, we are looking at the environment within the hospice, and and for staff that are going to care for people in their own homes. So we are trying to work up a set of questions, but we want to engage with our patients and with our families to make sure that we've got those questions framed right for everybody. And so I've got some drafts that have been done, and I've done some engagement with our staff in the hospice around, do these make sense? Are these questions you would feel comfortable asking your patients and families about? And we've put a scoring system in. You talked earlier about questionnaires. You know, one of my big bugbears is a questionnaire where it's got a scoring system, and you think, what does that actually mean? So we've actually tried to create a very simple scoring system so we can benchmark ourselves. And definitions of which each of those mean, and then also a box where people can put free text in. And what I also want to do, as well as having the forms, is to actually be able to hold a number of times a year to have focus groups.
I love that.
So that we can come out to communities. Please, I would ask your listeners, please invite us to come out if that's possible. that, you know, for us to come out and do that with you. I'm wanting to speak to any GPs that would be interested, who might let us join their patient forums and the groups that they hold, that we could come along to, so that we can do it in a number of ways. But I'm also really open to anybody who's got any other ideas that we haven't thought about that would work for them.
Fantastic, thank you so much. So this actually does lead on to my other question, which you've already answered, and my question was going to be, how can our listeners help?
Yeah.
Because the programme goes out across the whole of the UK and to 54 countries across the world, and there is bound to be somebody somewhere who has maybe done this and overcome these challenges, and we would love to hear from you, because it's never about creating something new or reinventing the wheel if somebody's already done it. So I'm going to do a shout out on behalf of Tracey Craggs. If anyone who's listening has some information, some knowledge, you've done a project, how to capture feedback well from our diverse community. I think the focus group thing is a great idea. Yeah. But this is a little shout out for all our listeners. If you have any advice, any information, please just contact Rotherham Hospice. Ask for Tracey Craggs, or ask for me, Mirban Hussain, or just mention that, you know, you want to talk to somebody about feedback, and you will get put through to someone who will be able to take that telephone call and have a chat with you. So if you've just joined us, you are listening to Care Across Cultures on Link FM 96.7 with me, your host, Mirban Hussain. Today we've been talking about feedback, patient satisfaction surveys, why they're so important, and why we need to increase the amount of feedback that we get, because that's how we can improve our services, and that's how we can make our services appropriate and responsive for all our communities, for every single patient and their family that comes through that door. Right. So, this is another. I keep asking these questions, which I said I wasn't going to ask, but how long is this review going to take that you've done, and, you know, what are you looking at timescale wise?
So the review I aim to have finished by the end of September.
Okay, so quite
not
long.
But that's as initial, so that we can actually launch this in October.
Okay.
But obviously we will keep doing a review of what we're doing, so that we can tweak it and change it.
Of course.
With ongoing feedback.
Of course.
So there is some social media posts that are going to be going out, advertising some sessions that are going to be held on the 2 sessions that we're going to hold on the 9th and 10th of September. And if anybody would be interested in doing those or joining us, please get in touch, as Mirban has given out the telephone number, and we will call you back and arrange, you know, give you the details, and we'll look at transport and anything. But equally, if you would like us to come and do a session out in the community anywhere, please get in touch and say that, and we will facilitate that as well.
That's really good. I just need to sort of translate some of that, if that's okay. So, abhi jo Tracey कह रही थी कि Rotherham Hospice रिव्यू कर रही है पेशेंट सेटिस्फैक्शन सर्वे के बारे में, और 9 तारीख और 10 तारीख सितंबर में 2 सेशन रखे हुए, जहां कोई भी आदमी आ सकता है रोदरम हॉस्पिस में अपनी इंफॉर्मेशन, एडवाइस, गाइडेंस देने के लिए। ये नहीं, अगर आपको इंग्लिश नहीं आती तो भी कोई बात नहीं, वी विल इंटरप्रेटर की जो है ना हम ले आएंगे। अगर आपको ट्रांसपोर्ट गाड़ी नहीं है तो भी उसका भी बंदोबस्त हम कर सकते हैं। और दूसरी बात यह है कि अगर आप इन 2 दिनों में नहीं आ सकते तो फिर भी आप जो है रोदरम हॉस्पिस से रब्ता करें, क्योंकि हम जो है ना आपकी, अगर आप कोई ग्रुप में जाते हैं या कोई ग्रुप रन करते हैं, वहाँ भी हम आ सकते हैं आपका जो है ना इंफॉर्मेशन, गाइडेंस वगैरह फीडबैक लेने के लिए। बहुत ये अभी जो है ना आपके लिए एक सुनहरी मौका, गोल्डन अपॉर्चुनिटी, जहां आप एक बहुत बड़ा ऑर्गेनाइजेशन है जो आपकी राय चाहता है। तो प्लीज जस्ट, if you want to get involved, just call Rotherham Hospice, Google our number, get in touch, and also we will be sharing all of this information on social media, Facebook, Instagram. You know, have a look, find out. I know many of you will have my telephone number anyway, and if you're struggling, get in touch with me, and when I can give you some further information on this. Okay. So, Tracey, thank you so much for this, and you're not going to believe this. We've only got 2 minutes left. We've only got 2 minutes left. So, have you got anything else burning that you want to say before we sort of close down the programme?
Just a plea, please join in, please support us in being able to make this right for you.
Oh, that's so good. Thank you so much. Now, what I do also want to point out is that, yes, we are talking about Rotherham Hospice, and yes, we are talking about a specific review that Rotherham Hospice is conducting on how we collect feedback, and to ensure that the feedback that we get is from all our communities, all our diverse communities. Now, there will be a hospice wherever you live, wherever town, wherever city, you will have a hospice close to you. I don't know if they are doing a review, but I'm sure that just based on what Tracey has just talked about, that if you want to go and give them some information, advice and guidance about feedback and why you haven't given feedback, or you have given feedback and you've had a good response or a negative response, please reach out to them and go and have a chat with them. Because from what I know of hospices, they really do care, and they really, really want to know how best to improve services, and the only way any service can improve itself is through feedback from patients, families and the communities who are out there. So we are coming to the end of the programme. I just want to thank Tracey again. Thank you so much for taking time out, and we wish you well with this, and inshallah, Allah Hafiz, next week I will be back with another programme.
You are listening to Link FM 96.7.